Introduction to Nursing Concepts, Medical Terminology on the Infection Control Unit. This is Martha Olson. Nosocomial infections are a term we use for an infection that a patient acquires while they're in the hospital. It could be an infection like a urinary tract infection, pneumonia. Those are two very common ones, and that is looked upon very negatively. So our unit will be spending a lot of time looking at how we can prevent our patient from getting a nosocomial or hospital-acquired. The other name that we see, and it's probably used more currently today, is HAI, or healthcare associated infections, not just hospital, but it's kind of used mixed with each. As we look at that, many statistics and data talk about how many infections are acquired while in the hospital every year. That is being tracked, and that data is being out there and published so that people can see what is going on within hospitals. And so it's a big emphasis for nurses and healthcare providers to decrease infections patients get while in the hospital. MRSA is a specific type of resistant, it's called methicillin-resistant Staphylococcus aureus, and it is a huge problem in hospitals. We do the gowning and gloving and all the infection control procedures trying to prevent the spread of MRSA, but there are people that come in with that, and we usually do like a surveillance or screening to see if they do have that on admission. PPE is personal protective equipment. What that means is all of the things that we put on before we go in a room so that we are protecting ourselves, our uniform, so we aren't going out of that room then and spreading those infections or diseases to other patients. PPE, there's a certain order to put that on and to take that off when you are going in a room or coming out of a room, and Potter and Perry explains that very well, and the rationale for why the gloves go on last and the gloves come off first. They're the most contaminated, so they come off first when you're leaving the room. Infections, they can be either localized or systemic. Localized means it's in one place. It's red, it's painful from all the blood flow and cells coming to that area. Systemic means that it's throughout the body. It's in the blood. We usually do blood cultures to see if their white count is going up. And with a systemic infection, they're going to have a fever, they're going to have an elevated white blood cell count, whereas a localized infection will probably not have an increased white blood cell count associated with that. So when we have an infection, we have to obtain cultures, and there's two types that help us to tell what kind of bacteria are growing. Aerobic is a bacteria that requires oxygen, and an anaerobic is a bacteria that can actually live with little or no oxygen available. When we look at those two, when we get cultures, oftentimes the doctor will say get an aerobic culture, get an anaerobic culture, and so you just have to know which type of culture which type of tube to collect that specimen in. A is without. So when we have things like asepsis, it's the absence of a pathogen. I hope that my patients are all aseptic, because that means they're not with an infection. Asymptomatic is without symptoms, and so a patient that has no fever, they have no increased white blood cell count, would be asymptomatic. Colonization is kind of an interesting thought for this unit. It's the growth of microorganisms within a host, but without the tissue being invaded or damaged. When I look at somebody that's colonized, many of your healthcare professionals are colonized. They have the bacteria in them, but they aren't ill. And we know that the nares is the #1 place that healthcare providers are colonized. That's why there's a picture of the dog and the little girl with the cute noses. Sometimes we will swab the inside of the nares to see if somebody is indeed colonized. Cough etiquette is how you're supposed to cough properly so that the germs are not being spread throughout. They talk about coughing into your sleeve to prevent the spread. Bactericidal and bacteriostatic. You'll get in pharmacology. Static means to inhibit or slow, and cidal means to kill. And so when we have a bacteriostatic type of antibiotic, we know that it will slow And your bactericidal antibiotic is going to be the more powerful, that's going to take care of or eliminate the bacteria that we have. A microorganism can be a bacteria, virus, mold, or yeast. And when we have purulent drainage from an infection, it's usually a very thick, pussy kind of disgusting drainage that comes from that. A broad spectrum antibiotic then is looking at an antibiotic that tends to cover a lot of different diseases. We use a broad spectrum antibiotic before the report comes back that says what antibiotic will be most effective. That report is called a MIC report. It stands for minimum inhibitory concentration. What they do is they take a culture, they go down to the lab and they grow the bacteria, and then they try different antibiotics to see which antibiotic is going to take care of the bacteria or be the most resistant to it. And then they give you the report telling you what type of antibiotic and which one is going to work most effectively. Before you have that report back, the doctor needs to cover that infection with a very broad spectrum antibiotic so that hopefully that will work and the bacteria will not be growing in the body before you can get the right antibiotic going. Supra is above, and so when you have a supra infection, it's usually a secondary infection. You see it both ways. It's called super infection or supra infection, and they both mean the same thing. It's an infection that the body gets because they're run down. It's an opportunistic infection that the body says, oh, they've got pneumonia, they're run down, the white count is up, I'm gonna, cause another infection within that body. Virulence is the ability to produce disease, and I think of it as a strength, and that's why I put the strong man up here. Virulence of a microorganism is what is the potential of it causing a disease within that? How potent or powerful is it? Eratogenic infections are also not a good type. It's a Greek word meaning brought forth by the healer, or in our case, the physician or healthcare provider. It's an unintended event resulting from medical treatment or advice. And so if a physician would not wash his hands after touching this patient and palpating, and then go into the next room while making rounds, and somebody would get an infection that spread from the first patient to the second patient, that would be considered an eratogenic infection. As you can see, the little cat's trying to wash his hands, and we know hand washing is one of the #1 ways to prevent this accidental medical action of spreading infections. Immunocompromised is having an immune system that's not fully functioning, not strong. Your patients that are taking chemo and radiation, your older adults oftentimes are considered immunocompromised. People that take steroids are immunocompromised because it weakens that immune system. The leukemia patient I listed up there, and that's because they do not make enough of the white cells to be able to fight infections, making them immunocompromised. Leuko again is white. A leukocytosis is a white blood cell count that is above the normal range. We know normal white blood cell count is about 4,000 to 10,000. And so somebody with leukocytosis would have a white count of 10,000 or greater. Asepsis is free of infection. Again, A is without. And when we look at medical asepsis and surgical asepsis, we look at medical being clean, hand washing. Surgical asepsis is making it sterile, and we spend a lot of money and go to a lot of work to make that environment perfectly free of any germs or bacteria because everything we use is sterile. And then finally, the susceptibility, and that is the quality of being susceptible or that lack of resistance. And many of our patients coming into the hospital are very susceptible and have that susceptibility of getting an infection. And so this unit, with all of the protocol and procedures of how to do things correctly to decrease the chance of infection to patients and helping them, especially when they're immunocompromised, to be stronger to be able to not get an infection, is a very important part of quality health care. As we look at this unit, this is a very large part of your NCLEX. They ask a lot of questions related to this, and so having a good handle on some of the terms and words that go with this will be a great help in understanding the principles of infection control. Potter and Perry is our main textbook. Some of the definitions were listed on the individual slides. If you have any questions, let me know. Have a great day.